Hello and welcome back to Straumann Live from the Arena of Confidence at IDS. My name is Dr. Artemis Adkins, and on behalf of Straumann Group, I have the great pleasure to welcome Dr. Chen to the program to discuss Zirconia Based Implantology. Dr. Chen, thank you for joining me.
Hi, the pleasure's all mine.
Oh, thank you so much. Dr. Chen, before we begin, if you don't mind sharing some information about your background with the audience, I would appreciate it.
Okay, so good evening to all. It's a pleasure for me to be here. I come from Portugal, Lisbon, Portugal. I actually graduated the University of Lisbon, where you can see it. And then I became a post-graduation student at NYU with Dennis Tarnow. I spent 2.5 years there, then come back again to Portugal and finish my oral surgeon degree. It was 3 years full-time, and I hope next month to finish my PhD. So I'm 1 month away to finish my academic part.
Congratulations. Very good. If you don't mind, you're obviously here to talk about ceramic dental implant systems. And I want you to share with our audience a little bit of your background about how you became involved in research on ceramics and a little bit of background.
Okay, so actually a lot of people does me that question. And you know, why did you have involved yourself in research in zirconia implants? What was the motive? Well, actually, I'm from the Lisbon University. Lisbon University has some more a legacy about zirconia implants. Actually, when you look down to our records, one of the first PhDs that we had in Lisbon University was about the zirconia implants. It was Professor Vasconcelos Tavares, as you see in the picture. In 1994, the first PhD talked about osseointegration on zirconia implants and alumina implants. But it was 1994.
Right.
At that time, no one wants to listen about zirconia implants or an alternative to titanium. We're in the middle of the titanium era. We're in the middle of, you know, everything was progressing so fast.
Right.
Titanium implants were really the thing. So when someone has a research about zirconia implants, no one was going to listen to you.
We're ahead of your time still.
Yes, so when he found out that the osseointegration rate was the same, no one would listen. I mean, no one would listen. Research wouldn't listen, you know, clinicians wouldn't listen. But, oh boy, has that changed now, okay? Mm-hmm. So a couple of years ago, with all of this zirconia boom, we, as a team, you know, I am part of oral surgery and implant department in Lisbon University, where the director is Professor João Caramês.
Who's sitting right there
taking
a
right
picture
there.
of
It's taking a picture. It's taking a picture of us.
Busted!
So it's a busted. So together with Professor Elena Francisco, we decided to go back to that reality, go back to that research, and try again to see, you know, if osseointegration rate was the same. And then we set up 2 different PhDs. You know, Elena has just finished hers. It was on zirconia osseointegration. And I studied more the inflammation part, as you're going to see ahead. But the idea was that we are a university that has some tradition on zirconia implants. That's why I became involved, not only because we have that legacy, but also because, you know, with this fast boom of zirconia implants, we wanted to know, you know, some biological aspects of it. So that's why we decided to go for this research.
Very
and
nice.
That's why I became involved in zirconia literature.
Very nice. Thank you for sharing. And Dr. Karamesh is still taking video.
No, it's still taking pictures, you know, and videos.
You know this is streaming live. You're going to get it on YouTube. Okay, so your experience with the Straumann Pure ceramic system. I'm interested, if you don't mind sharing with our audience, your experience with the Pure.
Well, actually, because of this legacy, you know, 15, 20 years ago, we started to use zirconia implants. But as you know, only for, you know, small cases, small niches of marketing, you know, the holistic person that comes to you and said, I want a zirconia implant. And we started to do that, you know, but, you know, with small companies and so on and so on. You know the story.
Yes.
But 5 or 6 years ago, with the introduction of the monotype by Straumann, we rapidly fell in love with the implant. You know, we saw the monotype, we started to use it, you know, patients recognize the Straumann implant, recognize the Straumann company, and so it becomes more a reality. And with all this evidence on zirconia, with all this boom, you know, we started to use more and more and more and more. So our experience is obviously more with the monotype type of implant, with the Straumann ones, although we also have the first generation of zirconia implants experience.
Yeah.
And nowadays we have also the experience with the two-piece implants.
Right.
Not so many experience as the monotype, but basically in our clinic and the university, we've been using a lot the monotype. And we fell in love because not only the clinical product is very good,
Yeah.
no, the patients love it, but also because, you know, we went to the company to see how are they made. You know, we love that individualization of the
Yes.
product, to see each implant is going to be checked if it's ready to go. We like the pure, the cleanliness of the implant.
Yes.
And now, all of a sudden you have a product there that, you know, patients love it, clinicians love it, and it's totally safe. So more and more and more we are using zirconia implants.
Very nice. I'm glad you mentioned that you did a tour and saw. I
Yeah.
wanted to invite everyone who's listening, if you have a chance, to come and tour Straumann and tour Villeret, our production site.
It's amazing.
It's a humbling experience about what it takes. I always, you know, you get to the patient and you open the package and you do the implant, and it was always great to know that it was a Straumann product I could trust. It's great. You don't think much about it, but having had this experience for the last year and a half at Straumann,
Yeah.
what it takes
And it's
for us to get there and use that and open that product, it is an amazing, humbling thing to observe. It's great.
It was a big difference for us. You know, we used to the titanium implant. You know, the packaging, where the implant comes, is all more or less the same. You know, people, patients are watching.
Yes,
you know, they
of
see the
course.
packaging of the implant, but all of a sudden they see like this trophy. You know, they're going to place me an implant, zirconia implant. It's come on
It's
a
so
trophy.
pretty.
and individualizing mounting the packaging.
Mouth
So-
jewelry. Okay,
That's
talk
it.
to me. You talked about monotype and two-piece. I want to know, from your perspective, what are the benefits of each system? What's the benefit of the monotype for the patient? What's the benefit of the two-piece for the patient?
Well, we obviously have a lot of experience with the monotype. And the monotype has incredible features. You know, if you're into implant dentistry, well, first of all, not because it's a zirconia implant, but because it's a one-piece
Yes.
implant. It's a one-piece implant. If you look down to the literature, you know, most of our problems as implantologists comes from combining an implant with an abutment, the creation of a microgap, for example.
Yes.
So the microgap thing, you know, if you talk about marginal bone loss, what is the amount of marginal bone loss in some implant, you always address, well, it depends on where's the microgap, if it's supracrestal, echicrestal, and, you know, we always have that discussion, especially at NYU with Dennis Tarnow, you know.
Yes.
We
I
spent
suspect so.
2 years, you know, learning what is the biological width formation around, I don't know. And so we had always that discussion, and with all this, you know, it's supracrestal, infracrestal, echicrestal, always with the microgap. If you talk about, for example, platform switching,
Yes.
why platform switching impacts marginal bone loss? You know, because the microgap is inward, and so the microgap becomes a thing. Now the monotype doesn't have a microgap,
Right?
does it? So it's actually, by being a one-piece implant, brings some extraordinary biological advantages. And the second reason we started to use the monotype was because, you know, if you go socially and you ask, what type of abutment do you place? You know, most of the people will say, I would love the zirconia abutment, but in an internal connection, you know, and so on and so on and so on. And the monotype doesn't have that problem because it's a one-piece implant.
Yes.
So I like the combination of having a zirconia one-piece implant with no microgap and having the zirconia abutment at the same time.
Very nice.
But obviously, implant dentistry is not, you know, this ideal world where we only restore premolars and first molars, and it doesn't matter if it's one piece or two piece. Obviously, we restore central incisors that need guided bone regeneration, soft tissue regenerations, vertical defects, and so the two-piece implant, you know, came and give us a little extra tool, you know, so we can work. And now with the two-piece implant, we have the ability of respond to those clinical situations where you can really submerge the implant if you want. You can start working on different prosthodontic procedures on that. So both the monotype and the two-piece implant, they combine very well for all the clinical situations, which is amazing.
Very nice. Nice offering. Not a surprise.
Not a surprise. So we are working now, obviously, with the two-piece pure ceramic.
Yeah.
And actually, all those clinical situations where the monotype cannot be used, with the two-piece you can.
Very nice.
And so it completes the portfolio very well.
Very nice. Thank you so much. Okay, what about, from your perspective, what are some things that we now know about ceramic implant systems in general that you think would be valuable to the audience for us to share?
Well, you know, Zirconia based implantology in the recent years has developed a lot.
Yes.
Has developed a lot. You know, universities really came together. You know, societies are becoming bigger, and so evidence research is becoming bigger.
Yes.
There's a big difference between the first generation of zirconia implants and the second generation of zirconia implants. You know, the second generation of zirconia implants is clearly marked by this huge investigation field. You know, companies like Straumann are investing a lot on investigation, and we are really doing everything step by step. You know, remember that things, oh, you launch the product to the market and we clinicians, we try. It's not like this with the zirconia. It's really not like this. You know, the clinical trials are there, the in vitro studies are there, and we have the evidence.
Yes.
So it's much different from the first generation of titanium implants.
Yes, it is.
So.
It is. What about, no, go ahead,
No,
talk to me.
On the other side, we need to be careful because, you know, we're talking about implantology. You know,
yes, we are.
Although we love that, you know, the zirconia implant is going to be the great thing, we have to be cautious. You know, you have to wait for the 5-year data, the 6-year data. We have to be cautious because otherwise, you know, we're jumping too far ahead. So the zirconia research and the zirconia implants is solid. But we still have to continue like this. We cannot jump and say, now because it worked in this situation, let's everybody do full mouth rehabilitations, partial rehabilitations, let's place this in zygoma and so on and so on. No, we have to really go step-by-step situation. So
I did a literature review myself for zirconia systems, dating back to about 2004, and kind of trying to look for trends, but only for systematic reviews. The studies that compiled every other type of study in that year, what they showed, and year by year by year by year. And what I noticed was, in the earlier years that I was researching, there was quite a lot of questions about whether or not they were strong enough, whether or not it was okay, et cetera, et cetera. So their acceptance level was, these may be okay. Then fast forward a couple of years, the studies, the systematic reviews started to shift the language, and they started talking about, okay, this may be a viable option as a titanium alternative. Fast forward a couple more years, I kept looking, and there seemed to be an acceptance rate that went up over time, that overall, by 2018, the systematic reviews basically agreed that this is a viable alternative to titanium systems. So I think your point is well taken that we need literature, and I think we have a really good, strong base for now that seems to be heading in the right direction, that it's a predictable, good outcome.
yes, and another thing, if I may compliment, there is a huge difference, but a huge difference from the first generation of implants to the second.
Agreed.
The great difference was that we understand the errors that we made in the past.
Yes.
I mean, in the past, you were allowed to prepare your abutment with burrs, with every kind of burrs, and we found out that it was a mistake. And now every company has individualized abutments that you don't need to prepare.
To do this, exactly.
Just to give you an example.
I agree.
So there are a lot of clinical errors that we detect on this zirconia boom that we are not doing anymore.
Yes.
And researchers develop really strong bases for what is now the second generation of implant dentistry. Okay.
And speaking of research, I think something else that may be interesting for our audience is to hear about the differences between ceramic systems and titanium systems regarding inflammation. Do you mind sharing some perspective about inflammation around ceramics?
Yes, for sure. I'd love that team. It's my PhD thesis.
Aha!
I love that option.
I didn't know that you liked this topic at all.
I love that topic.
I don't know these things.
You know, actually what is behind the question is that do alloplastic materials evoke a superior inflammation on the human body? I mean, it's not only zirconia. If you place a titanium implant, a PEEK implant, or if you place some alloplastic material in your body, the question is how that soft tissue and bone react to that material. And you know, and for example, in my PhD study, we wanted to know the reaction of the soft tissue to zirconia, acrylic, and titanium.
Yep.
Now, when you look down to literature and Professor Blanco's studies and so on, you really see that the big difference is not in the histology part. You know, if you look down to the biological weight, the amount of vessels, and so on, they're all pretty similar. But histochemically, the way they communicate, cells communicate between each other, it may be totally different.
Yes.
So what we did in Lisbon was we set a randomized clinical control trial to see if inflammation was higher in titanium or in zirconia.
Yep.
And we studied interleukins, you know, all that system, interleukin 1 beta, interleukin 6. And what's really fascinating was in this, even in the animal study, we did an animal study and then the randomized clinical control trial. Both of the studies showed clearly that all of them evoke an inflammation pattern higher than the periodontal curvicular fluid.
Yes.
But titanium is much higher than the zirconia.
Yes.
There is no doubt about that. Of course, we need confirmation of these results and so on. But at the first glimpse, in a randomized clinical control trial, the titanium behaves worse than the zirconia. So inflammation, yes, it may be a cause for several diseases. Even if you ask peri-implant disease, it may be a cause. We don't know. It's open for discussion, at least. But we're there. I think inflammation will be key in how these implant-based restorations will survive.
Very nice. How about, if I'm a dentist out there and I have concerns about reliability of ceramic implant systems?
Oh, the famous question. The famous question. There is not one stage that I'm in that there's not a dentist that asks me, doctor,
I bet.
Will this break?
Yes.
It's going to break, right? How many breakage of implants do you have? Well, and the answer is always the same. There's a big difference, but a huge difference between what was the past and what is the present. I mean, there's no doubt about that. The second generation of zirconia implants, they have altered properties. You know, they have mechanical fatigue tests that are there. They have a lot of investigation before they come out to the market.
Yes.
So they will not break that easily.
Especially when they're from Straumann.
Of course, if you use it in the wrong positions, that's not a question of the implant. It's a question of your clinical judgment. I mean, do titanium implants break? Of course they break. How many implants have you seen that they broke?
Actually,
a lot. So
one that I will remember to my grave.
Okay, but the idea is that the mechanical concepts that we saw in the past cannot directly be translated to the second generation of zirconia implants because it's a totally different based implantology. So, well, is it going to break? No, it's not going to break. It's going to break if you use it wrongly. But, you know, we really have to be cautious, and we really have to stick to what literature says you can do and what companies say you can do.
Forced distribution, yes. Agreed.
So, if it's going to break, no. Other properties like, you know, will it be more peri-implant diseases or less in the zirconia implants? That's a hot topic.
Yeah.
That's a very hot topic.
Which I would like you to comment on again.
Well, thank you. I'm making the tough questions, and then you reply to me.
This is a whole other
another level.
Thanks for interviewing yourself. I appreciate it.
No problem.
Please continue. I like it.
No, the peri-implant disease is actually the second most the question that they make. You know, it's really because, you know, after do implants break? No, they don't break, and afterwards they ask me about the peri-implant diseases. Well, I hope, you know, that they really have a low incidence of peri-implant complications. That's why we are working on this and we are doing the investigation. It seems that it's prone to, but we still have to have more data on that to be, you know, we have to be careful with this new generation of zirconia implants. I think cautious here is the word. We have a fairly good product with very strong research behind. So it depends on the dentist also not to ruin all these things, because, you know, evidence-based research goes both ways. You know, companies have to work good, but the clinicians and researchers also have to work good. You know, it doesn't matter if a company says you only have to use this for single units, and then you go and you use it in a full mouth rehabilitation, and it says, listen, it breaks. It doesn't matter. So we have to be careful around these things. And especially today, where we have social medias and so on, which is very easily to do a full mouse case, take a picture and say, listen guys, I did this, and then all of a sudden it doesn't have the evidence behind that supports you. That can ruin our implant dentistry.
Well, and you know what, if you don't mind for a moment, we digress from what we were doing, because yesterday and the day before we had some conversations with some of the clinicians we were talking to about social media and patients today and how they manage their information intake prior to coming to the practices. And oftentimes, we're not the only source of information anymore, like it used to be. When I was a kid and I went to the dentist, I had no other alternative other than taking what my dentist said as my view on what was coming. He was the expert, she was the expert, and that was it. Today, it's not that way anymore. So patients now look for information, they make their own judgment calls. I'm curious from your perspective if you see the same, that by the time patients come in, sometimes they already have certain decisions made, and we are molding the practice style and treatment options also now in collaboration with the patient, where it didn't used to be this way anymore.
Yeah, it's true. It's very interesting that the world really changed. The world really changed. Patients are one thing, but they're not the ones that I'm worried about. It's the dentists that I'm worried about. Because I know dentists. We are dentists, right?
Yes.
And if we have a new toy,
proud
to be dentists. We like to use the new toy in everything. We receive an implant. Wow, let's do this. Let's post it. Let's say that we are the best because we did it first. That can be very tricky. It's like, Mr. Trump says, fake news. Fake news. Fake news. When you have
How did
something.
Trump get into this?
I don't know. But when you.
He's the wrong color.
He's the right. Well, but fake news is something that you hear a lot. And with social media, what you have is that someone does a clinical act, puts it on a social media, and it travels 2 times around the world before researchers and clinicians that are more experienced have a word to say. Imagine, do you place zirconia 2-piece implant in an immediate extraction socket? Well, I did it one case, let's put it on the internet, and suddenly all is valid. But you have to look at research.
Of course.
Is it valid?
Of course.
How many cases do you see in the literature?
Of course.
Is that going to survive? How much is the resorbable rate?
Right.
Should we graft? Should we not graft? There are a lot of questions that we still need answers, but we have to follow, the protocols.
Of course, yeah.
We cannot go out there and start to brag it about it. The patient, on the other hand, with the zirconia implant, it's different. Oh, they will come to your office saying,
know they do.
I want the white one. I want the white one,
I want the one
doctor.
that has no metal.
I want the white one. I
I
don't want the gray. I'm a white kind of guy. And so it's not easy for us to say, okay, if you're within the inclusion criteria for the zirconia implant, then it's okay to go. But if you're not, we're the first ones saying that, listen, your case is not for a zirconia-based implantology. We still have not the research on these type of procedures. Right. So that's where the arena that we are in today.
It's an exciting field and an exciting set of research coming through, and already a lot that has been. You're right. The level of research already available on zirconia systems is actually quite profound.
Yeah.
So talk to me now. Last question. You ready?
Let's go. Show
future
me the toughest.
Future of ceramic implant systems.
Well, I hope, let's cross the fingers, that the future is going to be white and bright, okay?
You didn't.
No, I didn't.
Okay, white and bright.
White and bright, because, implants dentistry nowadays, especially with titanium implants, has a problem, with the peri-implant. You were talking here about peri-implant diseases a couple of minutes ago. Depending on who you read, the incidence is from 10 to 25%.
Right.
So you have a problem here. So is zirconia going to fulfill the requirements to lower that incidence rate? We don't know, but we hope that it will. First of all, because it's less inflammation. So maybe that's a key point. Maybe, because peri-implantitis, as you know, is a multifactorial thing. So one of the things is that inflammation rates are less. So that may be key, for lowering those values. The second one is that we are dealing this very differently than the titanium, because social backgrounds demand that zirconia-based implantology is stronger on the research field to show results. You really have to convince clinicians that this is a good implant. So that demands stronger research, and that's what we are doing. And so it comes to the market already with a strong evidence and unlike titanium, that it would come as it is. So that is a key point for this, and maybe if you combine all these factors together, we have a strong implant and a strong implantology. So
very nice. Okay. What else do you want to talk about? We have another 2 minutes. Do you want to talk about anything else?
No. I just say that in Europe at least, zirconia implantology is growing faster and bigger.
Actually globally.
Universities are stronger, are getting together. Societies are being made that are doing a wonderful job.
Talk to me about that. I want you to talk to me about the societies, the meeting coming up.
Yes, in every continent, people are gathering into societies. When you talk about zirconia implant dentistry, we have strong societies in the United States. We have strong societies in Europe.
Yes.
Strong societies in Europe that comes to give extra development in research, which is amazing. And all of that are watching at home and here, if you go to the internet, you can look for societies that really will guide you on these zirconia topics, on research, on clinical applications. So it's here to stay. It's here to stay, and it stays strong.
There's a meeting coming up?
It's a meeting coming up in Europe in October. In Zurich.
Tell our
it's
audience.
A very strong meeting. Strong meeting in the sense that you gather the most influent investigators and researchers on the field to discuss about zirconia implantology. Yes. It's not clinical case or clinical applications and so on. It's really go topic by topic and say what is in and what is out in terms of research. So it's going to be in Zurich in Switzerland in October, and I hope to see all of you there.
Good. And what's the organization called?
It's the European Society of Zirconia Implantology, the SC. It's going to be great.
I wanted you to say that so they could look it up.
Okay.
Go Google it.
Go Google it.
Okay, Dr. Chen, I had fun with you. Thank you for joining.
The pleasure was all mine.
On behalf of Straumann Group, I would like to thank Dr. Andre Chen for joining me to discuss zirconia-based implantology. And on that note, from the arena of confidence in IDS, my name is Dr. Artemis Atkins. It's been my pleasure to spend time with you. We will see you later with another session. Talk to you soon. Thank you. Auf Wiedersehen.